views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to Bronx Talk. Tonight, it's the debate for the 86th Assembly District, the district that includes University Heights, Morris Heights, Fordham Heights, West Bronx, Mount Hope, and Tremont. In tonight's debate, we have two candidates who are on the ballot. There is a third, but the Conservative Party of the Bronx informed us that candidate Jose Marte will not be participating. From the Republican Party, a community health worker, it is Ariel Rivera-Diaz. Sir, thank you for joining us.
Thank you for having me.
And the Democratic candidate is the incumbent Victor Pichardo. He has served in this seat since 2014. Thank you for joining us.
Always a pleasure, Gary.
Tonight's program is co-sponsored by the Bronx Times and also by the League of Women Voters, a nonpartisan political organization that advocates for informed and active participation in government and works to increase understanding of major public policy issues. We are thrilled to have them on board. The general election is Tuesday, November 6th, and all eligible voters are encouraged to vote. Candidates in tonight's debate, I will direct a question to one candidate. That candidate will respond. And then we will have a free-flowing dialogue with the original respondent having the final say on the question before the next question is asked. At the end of the program, each candidate will be given the opportunity to deliver a one-minute closing statement. By prior agreement, the first question will be directed to the incumbent, Mr. Pichardo. Thank you again for joining us.
Of course.
America has been hit hard over the past week in the aftermath of a week of explosives mailed to leading Democrats and the media, a murderous mass shooting at a synagogue in Pittsburgh. Dialogue across the Bronx, the state, and the nation right now is about hate speech, anti-Semitism and racism, gun control, and a myriad of related issues. We have many state issues that we will cover this evening, but given the importance of the dialogue, I thought in an open-ended way we'd give both of you an opportunity to just talk about any aspect of this that interests you and give people an idea of what your thoughts are as you attempt to be elected to public office.
Well,
so we'll start with you, sir.
Well, of course. First of all, Gary, I want to thank you for hosting us today and talking about this important issue about making sure that folks are informed and understand what's on the ballot. Words matter, Gary, and unfortunately, the President of the United States, Republican Donald Trump, has taken it upon himself to basically destroy his opponents through using words and inciting violence, not only in his rallies, but also encouraging in his own words and saying that I will pay your legal bills if you just beat up my detractors. And again, he doesn't tone down the rhetoric. He doesn't understand the magnitude of his words and the importance of his office. And it's important to understand that me as a Democrat, you know, when these things come to light, when words are attacking our communities, particularly communities of color, people who are marginalized, people who are in the LGBTQIA community, you know, I've stepped up, and it's important that we all step up regardless of party to make sure that we hold this president accountable, but more importantly to understand that he understands that words matter.
Thank you, Gary, for having me here today.
Sure.
I also would like to thank Victor Pichardo for accepting this debate. We have lost civility in politics, and it's been seen since the campaign trails of Donald Trump. And we have to come together as a community, show the federal government that the Bronx is strong. And civility will come back, and we will start to argue, debate, discuss about important issues with respect, integrity, and dedication for change. So it's really important right now more than ever in a political climate that we come together, we discuss and conversate about how we can move forward and how can we prevent issues and problems and tragedies like these to ever happen again.
Okay, So you can have the final word, and then we'll proceed.
I agree with my opponent. I think civility has to happen. But again, I think what's important is that the Republican leadership, not only in the state but nationally, has to hold their president accountable and say, look, these words matter. And you have to tone down the rhetoric because it's just simply inciting violence and particularly attacking marginalized communities across this country.
Mr. Diaz, as you are well aware, the Bronx does not have an elected Republican and hasn't had one since Guy Villela left the Senate in 2004. Curiously, your website does not mention that you are a Republican. There's one article there, but there's no other place do you talk about being the Republican candidate in this race. And in fact, some of the issues that you address in your platform are similar to what some Democrats are proposing. So what in the policies of the National Republican Party or activities of the state-controlled state Senate do you think are important for Bronxites to think about before they go to the polls next week?
Well, one thing I want to let Bronxites know is that I am no ordinary Republican. I'm not a Republican that comes from upstate. I'm not a Republican that comes from Indiana, Virginia, or Florida. I'm a Republican who has experienced homelessness, poverty, and I come from 2 immigrant parents. So as a Republican in the Bronx, I believe it's very, very important that Republicans in the nation and the state understand where Bronxites stand in poverty, house tenant rights, and in crime. Crime is running rampant in our communities. Poverty is running rampant in our communities. So it is important that I, as a Republican, present new ideas during this debate and after the debate and after the election period. It is important that we conversate and discuss about issues that are affecting everyday Bronxites and everyday New Yorkers.
Okay, thank you. You want to respond to that, sir?
Well, I think that, I really can't speak to my opponent's website or, his story, but I appreciate him trying to explain his ideas and show a different way. Look, I'm sensitive to the fact that, there are Republicans, not only in the Bronx, but across this country, who don't feel in a certain way. My father's a registered Republican. And the fact that I've had debates and I grew up in a household who appreciate the idea of challenging a person's stance, but more importantly, I think actions do matter in this case. Look, if people want to show that there are different Republican, we need to show that they can basically say to leadership that this is not okay, that that within the own party, because look, you want to get back to the old Republican Party, that's fine, but we need to show leadership from top to bottom, right to left, and make sure that everybody does have a voice. But in the Democratic Party, which we are a Big Tent party, we have shown that. We bring people in. We understand that words matter, but more importantly, we show leadership in all sorts of issues, not only in the state, but across this nation.
You can have the final word, sir.
I believe that I, as a Republican that comes from the Bronx, I know the importance of the issues that are affecting everyday New Yorkers. Along with that, I have also experienced those struggles and difficulties. Unfortunately, today in modern day politics, it's all about party. Whether you're Republican, if you're a Republican, immediately it goes for the insults. If you're a Democrat, immediately for the insults. So it's quite unfortunate what we're facing today. It comes from both parts. It doesn't come from one part. We have multiple elected congresswomen and men calling for violence against Republicans. Eric Holder, when they go low, we kick them. What is that? You're just stooping down to the same level as Donald Trump. That is really, really disrespectful and despicable to the voters in this nation and in New York.
Thank you very much. Mr. Pichardo, the Bronx has the worst health care indicators in the state.
Sure.
It's well known. Its education indicators are consistently low. Poverty and homelessness rage. Democrats have been in office exclusively in the borough of the Bronx. Would it be unfair for someone to say, this isn't working? Maybe it's time for a different approach to solving problems.
Well, let's put this in historical context. First of all, when Republicans were the single party, not only in the state legislature, but basically around the country in the 1980s, we spoke about this issue of trickle-down economic theory or supply-side economics, which was popularized under President Ronald Reagan. And during that time, where President Reagan was going around saying that, if we give those who have the most and the job creators, we're going to create economic prosperity for everybody. And that hasn't been the case. In my community, we've had to basically clean up a generation or generations of mistakes from the Republican Party. And yes, I mean, this process does take a while, but we have seen some improvements here in the Bronx. People are working. We are down to the lowest unemployment rate since, I believe, in the 1950s. Again, we are the largest safe city in the nation, and that is because of the leadership that we have shown. But again, this has sort of been generational issues and problems that have been created, from the war on drugs to Rockefeller drug laws to basically taking an entire generation of people of color and locking them up. And then when they go back to their communities, in my district particularly, there was nothing to come home to. There were no opportunities because we said we should lock them up, not care about them. And this is Republican policies. And what we've been able to do is raise the minimum wage, raise the criminal age of responsibility, and give people hope and the opportunity to see another way forward.
Sir?
I've always said that health is the center of all success. And currently our Medicaid and Medicare system are failing the recipients and our patients. So as a community health worker, I've seen the disparities and all the issues that affect our patients here in the Bronx. I work with multiple small practices, multiple doctors that care for the community but don't have the resources to give to a Medicaid and Medicare recipients. So it's an unfortunate thing that's happening currently with our system. So it's something that we have to tackle head on, something that we have to discuss about, because I've always been a big supporter of discussing, debating, and
I guess that's why we're here today.
yes. So completely forget about party politics. Talk to the people who care. Right? You have two people here, Victor Pichardo and I, who care for the Bronx, who had the courage to come out, debate, and so yeah, as my history as a community health worker, there are many things. There are so many social determinants of health that our patients have to face. We need more resources for Medicaid and Medicare patients, and we need more education for our patients. So.
Thank you very much. You get the final word.
So very quickly, as a member of the New York State Legislature, particularly in the Democratic majority in the State Assembly, we've been able to pass single health care in the state for about 4 years running at this point. And unfortunately, it gets stymied in the GOP-controlled state Senate, and they don't even want to leave an open discussion for debate. They think it's too expensive. And right now, on the national level, Republicans celebrated the idea of kicking about 33 million people off of health care, and basically said that this was a win for the American people, but this was a win for the insurance companies. And here in New York State, we've been leading the way in making sure that we not only pass single payer in this country, but we pass it in the way that makes sense to everybody and ensures as many New Yorkers as possible. And basically, people shouldn't be going bankrupt because they can't afford a medical bill, or a child is sick, or an elderly patient is sick in their care. So, we've been leading the way, and I hope to continue to do so.
Let's continue, Mr. Diaz, with talking about health care. You have mentioned about the need for improved health care. The debate has been clear. The Assembly has passed a single-payer plan, but it has stalled in the Senate. Is that the right plan for New York? You talk about reforming health care in the state of New York. What is the plan? What does need to be done?
Like I said before, we need more resources for our patients, more resources in schools, and more resources in our small practices. I remember going to a practice in Grand Concourse where their laboratory is right in front of the waiting room, and that laboratory is always open because the door hinges don't work. The conditions that our small practices find themselves in is very dire, and they're very bad, especially for the patients who most of them are suffering from chronic illnesses like diabetes, asthma, and heart disease. So with the Senate blocking the single-payer health care, there has to be a reason behind it. And one of those reasons is because of the payroll tax that will affect employers if single-payer health care does get enacted in the state. Mm-hmm. Payroll tax is going to increase for employers by 12.2%, and non-payroll tax is going to increase by 12.4%. Now, while it is a viable solution, we have to look at the cost and the struggles that will cause our Bronxites, that will cause New Yorkers who own small businesses.
So I just want to be clear. So you are in favor of a single-payer plan, or you have another vision of what needs to be done in the state of New York?
I believe that we need to approach it a different way. Not just go at it, just say, boom, single-payer healthcare. No, we have to discuss it with upstate Republicans, because there is a reason why Senate Republicans are blocking this. While it is a viable solution, it's going to be very costly.
Okay, sure.
Well, I mean, if we look at what costs an individual person if they go into the hospital and they don't have any health insurance or they're underinsured, you're basically just breaking the bank, taking people into, basically taking them into bankruptcy and having them evicted and exacerbating this issue of poverty, not only in the Bronx, but across the state. So, you know, my opponent is right that we do get one single bite at the apple. That's why I've been so deliberate in thinking about this issue. Yes, taxes might increase over the long period, but then again, you have to remove that that employers are not going to be burdened with basically paying for health care for their employees. So that's a wash, if not a net gain for some small businesses. But again, there will be some pain if there's some transition. But ultimately, I think there have been countries who have been able to do this and do this well. What we want to get to a point is, Gary, is if a person goes to the hospital, breaks a leg, gets sick or something, they get seen by a doctor, they get prescribed something, they go to their pharmacy or local whatever, and then they go home and they don't have to worry about, like, how am I going to pay this bill? How am I going to pay for my prescriptions? How am I going to pay for my copay? Because it's just been onerous, and ultimately the most of the money that goes into our healthcare system, it's about administrative costs, it's CEO pay, and ultimately that's not fair. We have to provide great high quality health care, but we have to do it cheaply, then it doesn't bankrupt New Yorkers.
You get the final word, sir.
In order to achieve high quality health care, we need the community involved with our patients and Medicaid and Medicare recipients. I, as a community health worker, have seen a lot of patients, their health be improved because they had somebody that's guiding them along the way of managing their asthma, diabetes, or heart or other chronic illness. So, yes, government involvement is up for discussion, but what can the community do right now to ensure that every single Medicaid and Medicare recipient, whether or not you have insurance or not, are receiving affordable, quality health care in the Bronx and in New York?
Thank you very much. Mr. Pichardo, Bronx neighborhoods that have wrestled with drugs for years are being overrun. And Bronx neighborhoods who thought they did not have a drug problem are now finding it right on their doorsteps. What is being done and what could be done on the state level to address this very, very difficult opioid epidemic?
So there's a lot of things that are happening right now in the state legislature. There's a bill that is being circulated by Assemblywoman Rosenthal from Manhattan about creating safe injection or safe injection sites that basically take folks who are on the street using drugs, putting them in sort of a safe location. It's been done in Toronto, and basically give them a place, like, if you want to shoot up, there's still resources for you to get clean and not get off these drugs. Also, again, what creates people the ability or makes people feel that they have to fall to drugs or alcoholism or anything like that is that there is sort of this sense of despair and hopelessness. And what I've tried to strive to as a member of the New York State Assembly is to give people hope. One, not only helping with people stabilize their housing condition, but also on Thursday, on November 1st, I'm hosting a job fair and helping people get on their feet, find work, and again, it's giving them that sense of pride and dignity that most people deserve. But more importantly, we have to make sure that we don't treat this as a crime problem, but we treat this as a public health issue. And unfortunately, since from Rockefeller drug laws to all sorts of things that the Republican legislature has done over the last couple of generations, it has had an exacerbated effect here in my district and in different parts of the city.
Sir?
I'll have to agree with Mr. Pichardo about this being a public health issue. Most of the people who are using heroin, using hard drugs, come from very, very poor neighborhoods. The rent is high. At one point, they were homeless, and that really did affect them. How do we approach the opioid and the opioid crisis is with compassion. Understand how these people got to this situation. So one of the reasons why I've seen a lot of people use drugs is because of poverty, right? And like Mr. Pichardo said, they feel hopeless, and they feel despair on a daily basis. How can we, as leaders, the both of us, come together and discuss on how to help the people who are using hard drugs, and how can we come together as a community to give these people the resources they need? Unfortunately, I'm going to have to disagree with Victor Pichardo with having those safe sites to shoot up. That's just incentivizing people to actually use those drugs, and that's I agree with him with a lot of points except for that one point. So I believe that we need to tackle poverty, we need to tackle crime, and we need to make sure that our people feel safe in their own communities.
Let me just broaden the dialogue because each of you have addressed two aspects of it. One is prevention and what causes drug abuse, and the other, of course, is treatment. So I will give you each a chance to
Sure.
take a look at it.
Sure.
Is there a percentage? Do you say we've got to focus more on prevention, we've got to focus more on treatment? You assign a percentage to it, or how do you view really attacking this problem?
Well, first of all, I believe an ounce of prevention is worth a pound of cure. But we've come to the point where there's so many people who are chemically addicted to drugs. We have to figure out a way of treating them in a way that's not just locking them up, which unfortunately has happened over the last 40, 50 years, and particularly in communities of color. So we have to figure out innovative ways. We have to think outside the box. And there have been successful models outside of this country, particularly in Toronto, that I can point to, that have shown the use of drugs going down. And it's not just only creating safe injection zones, but also it's creating more rehabilitation centers. It's creating more of the opportunity for people not just to get medicine like methadone or anything like that. It's about creating opportunities for individuals so that they can get off drugs and stay off drugs. But again, it has to be looked at as a public health issue and not as a crime issue that has been looked at in the past.
You can weigh in, sir,
Yeah.
on that aspect that I just brought up.
Yeah, I believe we need to focus on both prevention and treatment. If we just focus on treatment and give all of these opportunities for people who are addicted to use these drugs, what I see is as it's a way of justifying that. It's telling them that yes, you're in a good situation, but no, they're in a horrible situation. They need help, right? Especially with our young community. One escape that they see is through drugs, right? They're experiencing the poverty and the crime that surrounds them, and the only escape is through drugs such as heroin, opioids, K2. And another point that I forgot to mention before is that our insurance companies, our doctors and insurance companies, they prescribe hard prescription drugs, which can lead to future addiction. So what can we do as leaders, as a community, to ensure that doctors, and I as a community health worker could help with this, right? How can we come together and see that our patients are getting effective but non-addictive prescriptions?
Let's get a quick final word from you, and then we'll move on.
So again, I just want to make sure that we change the narrative on the issue of drugs, that it's not a crime issue, that it's a public health policy issue. And unfortunately, it hasn't been seen that way, and we need to make sure that we create a new, innovative ways to dealing with this issue.
Under the category of tell me what I don't already know, NYCHA has problems. But public housing is run by the city and largely funded by the federal government. So, Mr. Diaz, what can a state assembly member do to positively impact what in many cases has been an absolutely desperate situation? We don't have a lot of time, so just do about 30 seconds
sure.
each on it.
What we can do is, as assembly members, is to have some oversight on how this funding and how this money is being used. As you guys may have heard, the Trosneck, in NYCHA building in Trosneck, was infamously known for having big, inappropriate parties inside one of the apartments of the NYCHA building. Is this really what the federal government and the city government is investing the money in? We need to see and act upon this situation right now.
Thank you.
So, I mean, to clarify a little bit, so to what was said earlier, the federal government has effectively disinvested from public housing, not only here in New York City and New York State, but across the country, and it's left the burden on ourselves here in the city as well as the state of New York. But more importantly, what we have to make sure, and I've called out the city of New York for its negligence in NYCHA, particularly in Claremont Cooperative, which has seen just this infestation of rats. But I myself have taken action. We're going to basically dole out about $3 million to a local NYCHA development in my district to help repair the roofs. I've worked with Monterey Houses to help make sure that we clean up the foyer, install cameras, and make sure that the security doors are open, but also that we make sure that people have safe and livable conditions in NYCHA and hold the city accountable.
You get the final word, sir, before our closing statements.
Yeah, I do have to agree that the federal government has defunded the public housing budget, but it's NYCHA. It's called the New York City Housing Association, right? The state and the city have to come together and discuss ways they could solve these issues. There are a lot of rat and cockroach infestations.
Yeah, we need to wrap it up because we want to give time for
Yeah.
closing statements.
So
Okay, real quick.
what how Victor Pichardo said, so we have to come together as a city, state, and put away our differences and just go and tackle the problem head on.
Okay, we're ready now for closing statements by prior agreement. The first one for you, Mr. Pichardo.
Well, to Mr. Rivera-Diaz and to you, Gary, and to the sponsors, I want to thank them for the opportunity to sponsor this debate. I think it's a really good exchange of ideas. But more importantly, in the last 4 years, as your member of the New York State Legislature and the New York State Assembly, I've worked and endeavored and I've shown up. Again, I've not only passed and increased the minimum wage to $15 an hour, we increased the criminal age of responsibility for individuals. We've created innovative ways to help people get off crimes and also get off drugs and all sorts of negative behavior. But again, if given the opportunity to continue to
30
serve,
seconds.
I will make sure that I will continue to show up at work, to show up for my community and make sure that we do what we can to help mitigate the problems and the mistakes of the past and show a better, brighter future for the Bronx.
Thank you very much. Mr. Diaz, you get the next one.
As a 20-year-old Bronx Republican, I have experienced homelessness, poverty, and I come from 2 immigrant parents who have given their lives to ensure that my education and my life and my safety are in good hands. So I believe that we need to take back the Bronx as a community, not only in the 86th Assembly District, but as a whole borough. It is important that our voices as Bronxites is taken seriously and valued by the state.
30 seconds.
It is time now more than ever to organize and protest so that our voices can be amplified and heard. Today, November 1st, as a 20-year-old Bronx Republican, I say let's take back the Bronx.
Thank you very much. Gentlemen, I think our viewers will agree you have exemplified the best of the democratic process. Having respectful dialogue and interchange of ideas is what's going to help save our communities, and we appreciate you participating.
Of course, thank you for the opportunity.
Today. And while you may disagree on issues, I know you all will agree with me that every eligible voter should come out and vote on Tuesday, November 6th. We also want to thank our co-sponsors, the Bronx Times, and also the League of Women Voters. For more information, you can call the League of Women Voters at 212-725-3541. We thank you for watching. We thank our producer is Helen Greenberg, our director is Nick Marrero, and we want to remind you, please go out and vote on November 6th. Good night.